Sure. I'm Dr. Kimberly Dunsmore, and I'm the Chief of Pediatric Hematology Oncology at the University of Virginia Children's Hospital. I actually arrived here in 1993, so I am 20 plus years at the University of Virginia Children's Hospital.
So can you talk a little bit about the state of children's care in 1993 and how you've seen it progress to where we are now?
Yes, I think particularly in my field in pediatric oncology, we've seen tremendous innovations. So when I first started here at the university 20 plus years ago, if we treated a child with acute lymphocytic leukemia, their chance of being cured was about 60 or 70%, and now it's 90%, 90+% for most patients today. And that's through all of our collaborations with basic science, with clinical science, all the research that we do.
Great hospital.
Sure. So I participate with the Children's Oncology Group, which is an international research group for children's childhood cancer treatment. And I am the primary investigator for T-cell leukemia for that group, and have written 2 of the recent protocols using innovation drug therapy to treat childhood T-cell leukemia. And we've increased the event-free survival in that group from about 70% again up to about 80 to 90%. Another research innovation that we have here at the university is that I'm participating with basic scientists here to actually take children who have relapsed solid tumors that don't have effective therapy and sequence the DNA, the genome, the genes in that tumor, and find new drug therapies, innovative drug therapies for those children. And we have that program ongoing here at the university. I think we're at a good place now because of the coming together of a number of different parts of our community and institution. We have institutional support for children's health. Our community supports us greatly. I think we're coming together as a culture, as a pediatric culture, to try to provide not only innovative care, but the safest care for all children in our community. And I think the changes such as initiatives in the pediatric intensive care unit that have really looked at decreasing infections and catheters that our children have, I think are working together, collaborating with our scientists across the grounds here to develop innovative therapies has helped tremendously. I think our community support for our children's health and for the new freestanding outpatient clinic building will enable us to provide excellent care in a wonderful setting for our families and our children. Yeah, our community is incredibly generous, and we have benefited from that, both with funds that have been raised to help us do innovative therapies, to fund some of our research initiatives and our clinical missions as well. But I think more importantly has been the interaction with families in the community. We participate in a lot of different events, and one of our favorite ones is the UVA Dance Marathon. And we attend every year. And every year we actually bring our patients, our families, our own families. We participate in dancing with the students and having a great time. And every year we develop a little video that we give back to them as a thank you for all of their help throughout the year and for their fundraising, and it's a great, joyous thing to do. We have our patients come in, we have their families come in, we film everybody dancing, we have a great time, and last year we had a flash mob, so it was really great. I think also just knowing that we're in a community that cares that much about their children's health and that are willing to put in not only resources but time, it's a wonderful place to work. It's a wonderful place to live. I think it's because we're all passionate about what we do. We very much believe in our missions, and our missions are to provide excellent clinical care, innovative therapies, to do research to provide those cures, to educate the next generation of doctors that are coming up. And I work with a wonderful group of people that are dedicated to these things and dedicated to our patients and families. We believe in what we do. We're passionate about it, and we're happy to be out there showing our support for the community in just the way that the community shows their support for us. Right. So excellent care doesn't get done by one person alone. It gets done by an entire team, and you need an entire team to give our children the best care that they can have, and to make sure that it's family-oriented, family-centered, because without that family, there's no true healing or health to be had. And so we utilize doctors. We have nurses that work in the clinics on the floor, specialized nurses who are trained primarily in oncology and hematology, who work to help the families become more educated about the disease and how to help their child. We have social workers that help with all sorts of things. We have education specialists that make sure the children stay on track with their education while they're going through this journey with us. In adult world, you see you're a patient, you see one person, and you are working with them through a difficult time diagnosis or journey. But a child really does need a family-centered approach for this to be successful for them. And I think that's the difference between pediatrics and adults. We have to see it in a more holistic sense, if you will. We have to see it as a journey for the family along with the patient, and it takes a lot of people to help people along that journey. So I think that one thing is that I know what good has come over the years of seeing my patients work through their journeys and become healthy adults with families of their own who come back to visit me. I see them a lot. That helps to inspire me. And but I also want to talk about the patients whose journeys have an end, that they succumb, they die from their disease. And it's also a privilege to take care of them during that period of time. I think what I feel as a physician is that may be one of the harder things that I have to do, but it is something that I think, I'm sorry, I'm getting a little, it is a privilege to take care of children and their families when they're going through the end of their journey with us. If we can make that passing as easy as we can, full of care and love, then we have really performed the most excellent form of physicianship that we possibly can. So I think that working with the Children's Miracle Network has been so wonderful for this institution, but also for our community as a whole. The University of Virginia Children's Hospital isn't just for people living within the confines of Charlottesville. We actually are a children's hospital for the Commonwealth of Virginia. And it allows, that participation with Children's Miracle Network allows us to draw in our entire community. They feel a part of us. We help provide the care that they need. It has been very useful for many things, for children's services here, for family services here, support for that, for research support. We couldn't do the things that we do here without that kind of support from the larger community. That's all right? Mm-hmm. All right. So here at, see now I'm not going to be able to do it. Okay. Okay. Here at UVA Children's Hospital, we are committed to having every child have their healthier ever after.